And welcome back to Daytime. We always like to bring up topics of interest to you, both on the entertainment front, but also on the medical side of things. And if you are a senior, or perhaps you have a parent that is going to be traveling, or just not really looking after their health care the way they should in a preventive manner, then I think you'll be interested with this next discussion. Please welcome to the show Dr. Derek McDonald, Doctor of Optometry with your office up in Waterloo. Thank you for dropping by today, sir.
My pleasure. Thanks for having me.
First thing I always look for when I meet a doctor of optometry is if they wear glasses.
Contact lenses.
You have contact lenses.
I do.
Okay, well, that's kind of interesting. I think for some people, when we mention that you're going to be on, we're going to talk about an eye checkup. First and foremost, people think about just whether they're going to need glasses or not. That seems to be the foremost reason why people get their eyes checked.
And one of the biggest reasons why we see people ignoring the need for a regular eye exam is they figure, I'm seeing well, I'm not having many headaches, and they defer a really important preventative health checkup.
Or they're able to get those eyeglasses at the drugstore that'll just kind of make up for the pair they sat on.
Correct.
And they think, well, as long as I'm seeing fine right now, there's little else that could go wrong. That's not the case.
No, most people don't realize that the vast majority of significant serious eye disease will have no symptoms. It's often the minor conditions that will bring people in because there are symptoms. There is redness, there are headaches. Some of the more significant problems don't have any symptoms until it's far too late.
It's interesting because when you go to a dentist, at some point the dentist will come in and do an oral check of your mouth cavity, because from what I've been told, that can be indicative of another problem elsewhere in the body. Same thing for the eyes?
Exactly the same thing. One of the more common things that we will see, especially in a seniors crowd, or maybe even in the 55 plus crowd, maybe not a true senior, are things like diabetes. And diabetes is the most common cause of blindness in working age adults in Canada, and it's growing exponentially. And one of the first places we'll often see it is in the blood vessels in the eye. So critical time to get that looked at, and there'll be no symptoms. We'll see signs of the disease long before a patient has symptoms.
Okay, so if somebody is watching and thinking, you know what, it might not be a bad idea before we head to Florida, before we get on the road to have our eyes checked, do they have to specifically ask for certain tests to be done? Much the same way if I meet my GP for an appointment, I sort of have a mental list to ask for this, this, and this.
Right. For a comprehensive eye exam, if you call your optometrist and book a full eye exam, it will run the gamut. It will check your vision, it will check your eye coordination, it will check your internal and external eye health, tests to screen for things like glaucoma, cataracts, macular degeneration, the significant things that are definitely age-related and have a real impact on our productivity and quality of life.
Okay, I want to just go back to macular degeneration, because that's the one that you hear quite often associated with mid-40s to the 50s of that coming on. What is it? What causes it? Is there anything you can do, any vitamin you can pop to prevent it?
There are some revolutionary new treatments for macular disease. It gets a little more common in the 45 plus crowd, really starts to take off in the 65 plus crowd. But often, again, there will be no signs of any problem, no symptoms of any problem from the patient's point of view. So if during the course of a regular eye exam, we will detect warning signs of this, then yes, there are things you can do. There are vitamin supplements you can take. There are lifestyle changes you can make. Smoking cessation is important. A good diet is important. UV protection is critical.
See, we hear about smoking affecting a lot of things, but I've never heard it connected to the eyes.
Smoking will increase the risk of macular disease by 600%. It's not a small increase, it's a huge increase.
So macular degeneration meaning what?
Meaning
Give it to me in the Coles Notes form.
a loss of the central vision. So the retina is the light sensitive tissue in the back of the eye. The macula is the very central part of that retina. When you read the eye chart, when you check a text, when you're driving a vehicle, when you're looking at your kid's face, the macula is what is your central vision area. And macular degeneration causes that area to basically die. And it's an irreparable, irrecoverable loss of central vision.
So you
but
would
it
have
is
this
preventable.
peripheral.
Correct.
You would see almost everything around, but not as clear directly in front of you?
I will tell patients, you'll look at the word cat, you'll see the C, you'll see the T, you can't see the A. You look at your children's face, you'll see ears, you'll see hair, but you won't see the features.
And nothing that can be done about that.
If we catch it early, there are some preventive treatments. If we catch it a little bit later, there are some revolutionary new treatments that can reverse some of that loss. But again, prevention always trumps treatment.
And also, doctor, I would love to know if something like that happens in one eye, does it always happen the same in the other? Much the same way with a car. Usually if one headlight burns, the other one's going soon.
It's not always, there's no guarantee, but it certainly raises your risk
Okay.
significantly.
It really does. Okay, so the bottom line is to make an appointment to get that check. How often do you? I know my doctor has bumped our annual physicals every 2 years.
Right.
How often would you advocate someone getting their eyes checked?
Depending a little bit on the person's general health and eye health history, but as a rule, someone in the 65 plus crowd, an annual checkup is a very good preventative measure.
Okay.
For someone in the younger crowd, a child up to maybe late teens, probably annually as well. And many adults in that 20 to 65-year-old crowd who are otherwise healthy can get by quite nicely with a checkup every 2 years, but I wouldn't go much longer than that.
Okay. And just to clarify, this is not going into an eyeglass store and having them check for the strength of your eyes. That's simply to do with the prescription
Correct.
you need.
And that's part of a
Right.
comprehensive eye exam, but it's
Okay.
by far the most important part. It's really critical to get the health aspect checked in addition to the prescription aspect.
All right, Doctors of Optometry, the website that is on your screen right now is the best place to start and get in touch. Book an appointment. You'll feel so much better for doing so, especially if you catch something early. Very important information. To have your eyes checked, so important, isn't it?
Critical.
It really is. All right, thank you, Doctor.
My
Appreciate
pleasure.
your time today.
Thank you.